Good morning, everyone. Our report is about blood pressure apparatus with stethoscope. Medical conditions can be diagnosed through different methods and techniques. These methods may include physical examinations, laboratory tests, imaging tests, and other diagnostic techniques using medical devices. According to the World Health Organization, medical device is any instrument, apparatus, implement, machine, appliance, implant, reagent for in vitro use, software, material, or other similar or related article, whether used alone or in combination, including the software intended by its manufacturer to be used specifically for diagnostic and/or therapeutic purposes, and necessary for its proper application intended by the manufacturer to be used for human beings. These devices are to be used or to aid for the purpose of diagnosis, prevention, monitoring, treatment, or alleviation of disease, and even for investigations. Now for the main part of our topic, we have the sphygmomanometer, an instrument which consists of an inflatable cap which is wrapped around the upper arm and is connected to an armored manometer that records pressure in X over Y. X as the systolic pressure and Y as the diastolic pressure. In between the skin and the cuff lies the inflatable bag directly over the artery to be compressed. So in here, the artery is occluded by the inflatable cuff by means of a rubber squeeze valve to a pressure in excess of the arterial systolic pressure. As the cuff is inflated with air, a stethoscope is placed against the skin at the crook of the arm. This is used to listen to slight tapping sounds called thorough cough to determine the systolic and diastolic pressure. So, in here, the systolic pressure can be determined from the first sound heard. On the other hand, when a dribbling noise is heard, this marks the diastolic pressure. This pressure is released from the bag at the rate of 2 or more mmHg per heartbeat by means of a needle valve in the inflating valve. It may also be estimated through palpatory method or auscultatory method where blood pressure is determined from an arm. The anatomy of the sphygmomanometer. First, we have the bulb. It is a small, usually latex, handheld air pump that pumps air into the cuff. It has an end valve which prevents and/or allows air to escape. Next, we have the valve, which allows controlled deflation of the cuff, which is critical for accurate measurement. It also prevents air to escape while inflating the cuff. Next is the manometer. It is the portion that measures the air pressure in mmHg. Aneroid manometers contain a watch-like movement that measures the air pressure applied to the cuff. Next is the bladder. It is the inflatable bag. When filled, compresses the arm to occlude the artery. Cuff. It is an inflatable band that is wrapped around an extremity to control the flow of blood through the part when recording blood pressure with a sphygmomanometer. Next, stethoscope. The stethoscope is a medical device that is used to transmit low-volume sounds, such as heartbeat. It consists of 2 earpieces connected by means of flexible tubing to a diaphragm that is placed against the skin of the patient. It is used together with a sphygmomanometer to determine blood pressure. For the anatomy, we have the chest piece, which is also known as the head. Is the part of the stethoscope responsible for conducting sound. This is the part placed against a patient's skin. Next is the diaphragm. The circular end of the chest piece. On two-sided chest pieces, the diaphragm is the larger of the two ends. Its larger size allows the user to listen to a bigger area of a patient's body. The diaphragm is designed to pick up sounds with higher frequencies compared to the bell. Next, the bell is another circular end of the chest piece. On two-sided chest pieces, the bell is the smaller end. Due to its smaller diameter, it has a more restricted range that focuses on lower frequency sounds than the diaphragm. Stem. It is the part that connects the chest piece to the stethoscope tubing. It is usually made of metal or steel. On stethoscopes with two-sided chest pieces, it is also the part that allows the user to choose between the diaphragm and the bell. Next is ear tubes. It connects the stethoscope tubing to the ear tips. They are made of metal or steel and are designed to be at the optimal angle. Next is ear tips. The ear tips are the parts that usually go into the ear. They are usually made of rubber or silicone and have a hole in the middle for letting out sound.
So in continuation, I will now be discussing the proper usage of the medical device blood pressure apparatus with a stethoscope. So to begin with blood pressure measurement, we should use a properly sized blood pressure cuff or the sphygmomanometer, and we should wrap the cuff around the upper arm with the cuff's lower edge 1 inch above the antecubital fossa or the inverted triangular space that forms the transition between the arm and the forearm. So here is our device demo presenter, Miss Garabiles, and of course her beautiful sister. Then lightly press the stethoscope's diaphragm over the brachial artery just below the cuff's edge. Is my favorite part, which is rapidly inflating the cuff to 180 mmHg, then releasing the air from the cuff at a moderate rate of 3 millimeters per second. Now we will be listening with the stethoscope and simultaneously observe the dial or the mercury gauge. The first knocking sound is also known as the Korotkov sound, which we will be discussing at the next page, is the subject's systolic pressure. And when the knocking sound disappears, that is known as the diastolic pressure. Example, 120 over 80 mmHg. The 120 there is the systolic and the 80 is the diastolic. So here are the 5 distinct phases of the Korotkov sound. And what is a Korotkov sound? These are the sounds generated when a blood pressure cuff changes the flow of blood through the artery. And these sounds are also heard through either a stethoscope or a Doppler that is placed distal to the blood pressure cuff. So in phase 1, which has a tapping sound, this is the first sound heard as the cuff pressure is released. This sound also provides the systolic pressure reading. And in phase 2, which has a soft swishing sound, these swishing sounds are the blood flows through blood vessels, the cuff is deflated. In phase 3, which has a crisp sound, or in here it has a thump sound, which is softer than phase 1. This phase 3 has intense thumping sounds that is accordingly softer as the phase 1, and as the blood flows through the artery, the cuff pressure is still inflated to occlude flow during diastole, while the next phase has a blowing sound, a softer blowing muffled sound that fades. And as the cuff pressure is of course released, the change from the thump of phase 3 to the muffled sound of phase 4 is known as the first diastolic reading. So phase 5 is already silenced. That occurs when the cuff pressure is released enough to allow normal blood flow. This is known as the second diastolic reading, the phase 5. Now record the pressure in both arms and note the difference. Also record the subject's position or the supine. If which arm was used, the left or the right, the cuff size, if it is small, standard or large adult cuff. Then, if the subject pressure is elevated, measure the blood pressure 2 additional times, waiting a few minutes between the measurements. Here are some tips on how you are going to measure your blood pressure at home, interpretation of your blood pressure categories, and things to do to maintain or at least achieve a normal blood pressure. So first, make sure to follow the proper procedures when measuring blood pressure at home. And record the pressure in both arms and note their differences. And here is an important reminder. Don't place the cuff over a clothing, and also do not use too small blood pressure cuff, because studies have shown that using too small of a blood pressure cuff can cause a patient's systolic blood pressure measurement to increase 10 to 40 mmHg. And also, a bulky or a bunch clothing can raise your measurements by as much as 40 mmHg. So we always talk about this systolic and diastolic blood pressures, and what are they anyway? So this is the systolic blood pressure, which is the first number, and it is called systolic blood pressure because it measures the pressure in your arteries when your heart beats, or in short, it is the pressure exerted when blood is ejected into the arteries. And the normal systolic blood pressure is 120 mmHg or below, while here below is the diastolic blood pressure, the second number chart. And diastolic blood pressure measures the pressure in your arteries when your heart rests between beats. And the normal diastolic blood pressure is 80 mmHg or below. For normal systolic blood pressure, it is 120 mmHg, and for diastolic, it is 80 mmHg or below. So for the most awaited part, here is now the blood pressure category chart. So again, the systolic is the upper number, while the diastolic is the lower number. So mmHg is a short term for millimeters of mercury. So if you have a systolic value of 120 or less than over a diastolic value of 80 or less than 80, of course you are categorized as normal. But if you have systolic value of 120 to 129 and less than 80 diastolic value, you are categorized as elevated, or you have a pre-hypertension stage. And if you have 130 to 139 systolic value over 80 to 89 diastolic value, you have a hypertension stage 1. And if 140 or higher systolic value over 90 or higher diastolic value, you are categorized as stage 2. And for hypertensive crisis higher than 180 systolic value and higher than 120, you must consult your doctor immediately. And for pediatric patients, a lower blood pressure may indicate the presence of hypertension already. So to avoid complications related to blood pressure such as hypertension, dementia, or stroke and whatsoever, we must consult the doctor immediately for blood pressure lower or higher than normal, especially if our blood pressure is 180 over 120 mmHg or more, which requires, of course, immediate attention. And observing a proper diet is also important. Did you know that young people can have high blood pressure too? So high blood pressure doesn't just happen to older adults, because nearly 1 out of 4 adults aged 20 to 44 have high blood pressure already. And because high blood pressure is a leading cause of stroke, a condition that is on the rise of younger people, expert thinks that the increased risk for stroke in this age group, which is 20 to 44, is a direct result of the rising rates of obesity, high blood pressure, and the type 2 diabetes, conditions that are preventable and treatable. That is why diet is very important. You also know that high blood pressure usually doesn't have any symptoms. High blood pressure is sometimes called the silent killer, and most people with high blood pressure don't have any symptoms because many people feel fine. They don't think they need to get their blood pressure checked. And even if you feel normal, your health may be at risk. Talk to your doctor about your risk for high blood pressure. So for the new medical device, we have here the Gel Flow NT, in which upon opening the box, the device consists of 500 milligrams of gel foam sterile powder. It is an absorbable gelatin powder from Absorbable Gelatin Sponge USP, and of course a syringe, delivery system, and 2 applicator tips for delivery of the flowable mixture to deep and narrow administration sites. So this gel flow kit is indicated for hemostasis in surgical procedures, including those involving cancerous bone bleeding as a hemostatic device, or when control of capillary, venous, and arteriolar bleeding by pressure. Also for ligature and other conventional procedures is either ineffective or impractical, although not necessary. Gel Flow NT can be used either with or without thrombin to obtain hemostasis. Or in short, this Gel Flow kit's function is by stopping or controlling the blood flow either mechanically or by increasing the coagulation cascade during surgical procedures. And remember that these hemostatic agents does not only facilitates bleeding but also facilitates fast recovery of the patient. So here is the gel flow preparation steps, and to begin, transfer the inner sterile pouch of gel flow NT into the sterile film. But before that, of course, make sure to wash your hands first. And for the first step, it says here, draw up 5 ml of sterile isotonic sodium chloride solution, or what we call the sterile saline, or a solution of thrombin into an empty 10 ml sterile syringe with lure lock. And for the second step, connect the gel flow NT syringe to the sterile saline or thrombin solution syringe with the pre-attached connecting lure. For the next step, Begin mixing by pushing the sterile saline thrombin solution into the gel flow empty syringe. Then wait briefly for about 10 to 15 seconds to allow the gel foam sterile powder to become saturated with the sterile saline or thrombin solution. So you push. Then again push the hydrated gelatin back into the sterile saline or the thrombin solution syringe and continue exchanging the solution between syringes until all components are thoroughly mixed, approximately 10 exchanges, and the consistency is even. But if at any point the mixture does not appear uniform, perform additional exchanges between syringes to ensure contents are adequately mixed and the resulting mixture looks homogeneous. Now for the last step, disconnect the mixing syringe containing the hydrated gelatin and remove the connecting lure and attach an applicator tip if desired. 2 applicator tips, one quite malleable and one clear trimmable with retainer clip are provided. And also following the instructions given, this will yield an approximately 7 ml uniform mixture within the syringe, and a measured minimum delivery volume is 6 ml. Hemostatic agents, or sometimes called hemostats, are devices or products that facilitates hemostasis or coagulation of the blood. Their use joins the list of equipment and procedures to assist with the control of bleeding, such as direct pressure, bandaging, and elevation. Hemostatic agents available for the use in surgery are divided into 2 categories: the passive and the active hemostasis. When we say the passive hemostasis, this acts through the contact with bleeding site and promotes platelet aggregation, while the active hemostasis acts biologically on the clotting cascade to stimulate fibrinogen at the site to produce a fibrin clot.
And lastly, for the benefits. First is reduced operating time. This will enable doctors to have more time to look after patients who has more severe conditions. Second, minimize the blood loss and reduce the need for blood transfusions during surgery. Third, shortens the patient's stay in hospital. Fourth, lower risk for infections. Fifth, prevent post-operative complications. 6, reduces the morbidity and the mortality of patients.